Hi, everyone. So welcome to our webinar today. So taking a patient-first approach to digital care management. My name is Megan Mancini. I am the VP over Loop Customer Success and Implementation here at GetWell. So thank you again. Welcome to our presentation. Really thrilled that you're joining us today for what's sure to be a great conversation with leaders from Froedtert and the Medical College of Wisconsin. So I've had the pleasure of working with the Froedtert team since they came on board with GetWell Loop years ago, but really excited to share their story of success today with you all. So pleased to announce and introduce our speakers from the Froedtert team. So first we have Jamie Schunard, who is the Director of Orthopedic and Spine Programming for Froedtert Health in collaboration with Froedtert and the Medical College of Wisconsin. So with a focus on surgical care, Jamie is responsible for overall program development, quality improvement, cost containment, patient experience, and coordination of services across the patient care continuum. Jamie has been with Froedtert since 1991, which is so amazing. Joining Jamie is Natalie Mortensen. Natalie is a manager at Inception Health, also in collaboration with Froedtert and the Medical College of Wisconsin. She has a nursing background in multiple care areas and is board certified in nursing informatics. Her primary area of focus are program management and implementation. Natalie has been with Froedtert since 2009. So Natalie and Jamie, thank you again for joining us today. Before we dive into the success Froedtert has experienced with their orthopedic and spine program, Natalie, if you wouldn't mind just providing us with a quick introduction and background on Froedtert overall.
Absolutely, and thanks Megan again for having us today. So just a little bit about Froedtert and the Medical College of Wisconsin Health Network. We have over 5 hospital campuses. We're expanding and continuing to expand. We service southeastern Wisconsin, but as you can see, we've kind of made our way up the border there. So we have about 650 beds. We are an academic medical center. And then you can see we have a multitude of providers within our various facilities. What I'd like to focus on particularly is related to Inception Health, which you mentioned. Really, Froedtert has developed and kind of created their own digital health and innovation hub, which has been really vital to kind of drive the innovation, help solve problems, collaborate with different innovative companies. We have some investment opportunities and really kind of scale those solutions across our network. So we're really excited to be here, and I'll let you go with that.
Awesome, thank you. So through the next 20 minutes, I want to walk through a little bit of Q&A with both Natalie and Jamie. Our conversation will really encompass how Froedtert is leveraging GetWell Loop, as well as strategies for a strong Loop implementation and post-go live strategy, which has ultimately yielded very positive outcomes for both patients and clinicians working in the platform today within the system. So Jamie, I'm going to turn it to you because you've really been with this from the very beginning. But as a starting point, what made you all seek a digital care management solution?
Hi, Megan. It's good to be with everybody. Well, we have a big program. We perform over 1,000 elective hip and knee replacements annually. So it was really important for us to identify how to use best practice and standardize everywhere that we can across our program. We were trying to get our hip and knee replacement program in a good place as we were merging our academic physician practice with our community-based physician practice, which went really smoothly. But in the process of that, not only did we need to standardize our treatment protocols, but also wanted to standardize how we educated patients, spoke with them. So that was also a standardized model of care, and patients get the same experience. I don't know about other service areas, but our patients tend to talk to each other. And so we want them to have that same experience and have it be exceptional, so nobody feels like they didn't get the best experience possible. And we also wanted to be able to amplify that standardization using technology. So when Inception Health came to us with this opportunity, we were really interested in how could we do that? How can we not lose the human touch that we already were so successful with, but leverage technology to do that as well?
Amazing. So keeping those things in mind, how was GetWell Loop then evaluated as a potential platform, and specifically, why was it ultimately the right solution for you all?
Sure. Well, you're going to hear some themes now that are going to be repeated as we continue to talk. The GetWell Loop really speaks the same language that we speak. The loops really matched much of our existing education. So as we were merging all of our different physicians and how they spoke with their patients about hip and knee replacement, and then we looked at the loops, it was all the same kind of language. It was really helpful that we didn't feel like we were changing what we were doing. We were just, optimizing it. It helped us to provide patients with options for how they learn, connect, and communicate with our teams. If you have a background in clinical care, you know that every patient is somewhat unique. And so being able to customize what you're doing without losing standardization is really important for creating the best patient experience. That personal touch that I previously referenced, despite being on a digital platform, was important to us. Patients are gaining more and more accessibility and skill with technology, and so they expect us in healthcare to be moving with them. And this is really so patient-centric. It really helps us with our quality scores as well.
Perfect. And then I'm going to pick on both of you. Jamie, I'll start with you. But can you just talk a little bit more about your initial reaction to seeing the loops kind of in motion? So what resonated with you most as you piloted this technology?
So the loops, which are a kind of in my words, a combination of communications to the patient and education and opportunities to check in with our patients. All of those things get accomplished within the loop. The loops are really understandable. They used plain language. When our patient education folks talk to us about how do you communicate, it's about using a 5th grade reading level, being able to speak to patients so they understand it, but not talking down to patients. And the communication style that GetWell Loop uses really fits that model. So it really hits that sweet spot between being simple enough to understand, but also being educated and informative to our patients. We had to make very few changes to the content. So we had just finished developing a big education binder that standardized everything that we were doing for teaching our patients about their joint replacement. And when we looked at the loops, gosh, I would say 98% of the content matched.
Wow.
Other than, maybe the occlusive dressing that we were using, we wanted to speak more specifically to that. That's the only thing that's really coming to mind. Maybe some of the word choices that we wanted to change, but actually it was like, we could have taken a long time and written these loops ourselves, and it probably would have been the same. So it was a great way for us to leverage the GetWell content without us having to develop that content ourselves. So that was a really good thing for us. It looks like that communication from GetWell Loop comes from their surgeon, and many patients really default to their surgeon to drive their care. And so when they get that invitation and it comes from their surgeon specifically with a headshot of the doctor and a message from the doctor, they really take that to heart and they buy in early. We've also bolstered that by having an informational sheet that GetWell put together for us explaining what is the loop, what to expect as far as getting an invitation, how to enroll, why it's important. We use that with every patient at the get-go. So the nurse in clinic, when they decide to have surgery, is pulling that out of our education binder, talking them through GetWell Loop so they're expecting the invitation and they see it as a win for them. So that early scripting was really important and really helps us with how many of our patients participate, which we'll talk about later.
That's great. And I think just like that overall, just empathetic tone that it provides, and so glad that your team, that we were able to do some of this for you. It makes us so happy. Natalie, flipping to you really quickly, I just wanted to get your take. Were there any other aspects of Loop that worked particularly well for the team on top of what Jamie said?
Yeah, I think I'll just kind of ride on his coattails here because the content is so spot on. And we as Froedtert, with our internal resources, just don't have the ability or the people to actually create, come up with, develop implement all of what Loop has been able to offer to us. So it's really incredible. In the way that we actually review the content with our providers, we get kind of a focus group set up if we're looking to implement a new area, or if we are doing kind of a quarterly or annual review of the content. You know, procedures and things do change, standards change, different things happen within our own organization, which is also a benefit because of the customization, that we can take it and say, okay, I think we need to tweak this just a little bit because this changed, or we're using something different, or there's a different best practice that we're going with. All of that has just been so incredible that nothing is really set in stone. It's agile. We can move with it, and you guys move with us. And the other really cool thing is we just brought on a new hospital system, and we got together with their leadership in this area as well and sat down at the table and said, this is how we are practicing and how we are teaching and training our patients. How does this differ from what you are doing today? And can we get on board to standardize that together as one system now? And that was through an acquisition. So to be able to come to the table like that and say, this is our care model. We know that they may be doing it different or might have different resources, but they're like, yes, please, let's get on board. And I think that really speaks to the ability to scale with the content behind it in mind. So it's just been really incredible to watch. I mean, and this happens in other areas as well, but in particular with orthopedics. So it's been very cool.
Thanks for mentioning that, Natalie, because, you know, to have clinical care standardization occur because we were collaborating on the GetWell Loop, I mean, that's just icing on the cake. So to be able to take another physician practice doing hip and knee replacement and kind of fold them in, look at what we're all doing. And, you know, they had some great questions about, you know, why are you saying this in the loop? And we had to like, oh, that's a good question. Maybe we shouldn't say that, or we should do it differently. So it really helped all of us to elevate the bar and do better.
No, that's great. I think when we talk to organizations, there's this thought that you can only customize during the implementation process, right? And then once it's live, that's what's there. And that's not the case. It's really, you're learning so much first as patients go through the platform itself. You learn about how they're interacting, what's making sense, what could be better, where it could be optimized. And then Natalie, to your point, just bringing in those standardized best practices, we do that throughout the full duration of the partnership. And it can always be changing, always can be customized. So I think it's a really important point to hit on.
Yeah, there's been, oh, sorry, Megan, there's been a couple of other instances, and I'll just reference that because you touched on it, but that we have noted, you know, again, we bring our focus groups together or our first responders together, and they're like, you know, we're getting a lot of questions on X, Y, or Z from the loop, when really it's not intended to create additional questions. So that's where we, I mean, you know, we come back all the time and say, can we adjust? Can we tweak? Can we look at this? Can we maybe take this out or add this in? Because the whole point of the content is really, in our minds, to anticipate the needs of the patient and be proactive versus reactive. So that is the beauty of at least having some feedback loop on that to say, this isn't working the best that we thought it was, or it's not solving the problem of the patient asking this repetitive question. And then we can put in an intervention and move on from there. So it's incredible that we have that ability.
That's great. No, thanks, Natalie. So Jamie, I do want to stick to come back to the implementation process for just a little bit. I feel like those listening to this will be a key part in how they're thinking about implementing Loop within their facility or system. But can you talk us through how you all envisioned your care team working in Loop? So how are you able to take the platform and ultimately scale those resources in order to use it on the clinician side?
Sure, and I'll explain a couple ways that we're using it, and I think that is part of the beauty of using the Loop is you really can customize how you implement use of the Loop based on your care team model. And so that's, I guess that's the punchline of the story that I'm going to tell. So the comment first responders has been mentioned a few times. First responders are what we call those folks that are kind of in the trenches, looking at that interaction with the patients in the loop, getting back to them on questions. So they're the first ones to see that information and decide what to do with that. We have orthopedic navigators that work in our program. Shout out to patient navigation. If you don't do it, please consider that, but it's not necessary for doing the loop. So our navigators who do a lot of pre-education, patient contacts, they're talking with people, they develop a relationship, and they were managing these loops at first. We have also gone to a model more recently where our clinic nurses, so each of the nurses for our surgeons, are monitoring those loops as well. Really, either model works. Our navigators have commented, though, that, you know, all things being equal, they really enjoy doing the loops. It's an additional way for them to stay connected to the patient, and it helps to leverage the relationship they already have with that patient and leverage the information they know about that patient. So even though they're documenting about that patient, there's a lot of that personal stuff that they kind of inherently have in their knowledge base, because these are active patients that they're working with right now.
Right.
One of the things that I think can be scary for, you know, folks saying, wow, they have 1,000 patients a year, how are they managing all that? The loops are really set up so that you're interacting with patients based on exception. So if patients have a problem, the loop identifies that. It uses a kind of a yellow flag, red flag system of, as they respond to questions or surveys that are within the loop, it'll escalate that. And those are the kinds of things that the first responders would look at, or if the patient asks a specific question. So they're not engaging every day with 30 to 50 active patients. They're managing the things that really are important and have already, because the way the loop is built, floated to the top of the pile. So it actually makes it quite easy for those first responders to identify what needs to be dealt with and deal with those things. It also has the ability to pass that information on to other members of the care team, so that if say a program had a medical assistant doing that management, they could pass that on to the nurse or the doctor, depending on what the issues are. Another thing I would point out is that, you know, doing the front end work with laying out for the patient, what is the loop, why are we doing this? Yeah, it's a little more work on the front end, but it really saves time on the back end. And that's why that we sell to our team when this is one more thing that they have to do, right? You know, because we're always doing that to our folks in healthcare. Here's another thing to do. By doing that work up front, which isn't that much, it really saves you time on the back end and makes the patient experience better. What else would I say about that? You know, I think everybody is able to work at the top of their license in this model. So you can decide based on your care model, and, you know, we're talking about hip and knee replacement, but there's dozens and dozens of loops for lots of different kind of diagnostic and procedure groups. You can really decide who is best to manage that, so that you're elevating your team and having them do their best work.
Yeah, no, it's great. And I think it's such a key piece in as groups are considering implementing something like this, understanding today, like, do they have a gap that they want to fill, or do they have the workflow set up where Loop can really become a chameleon to what they're doing and enhance the overall workflow? So I love that you touch on both of those instances. I think it's really helpful. So I think we have a good sense to this point around just how this was set up on the clinician side. You've really talked about how, like, the core theme in all of this is how do you continue to provide that exceptional patient experience. So I do want to look at overall impact. It's pretty amazing. Over 10,000 ortho patients have been supported to date at Froedtert through Loop. And I do want to dig into some of these success metrics. So where have you seen some of these key results within orthopedics, Jamie?
Well, you can see on the slide here, you know, some of our success. So, you know, the patient engagement. I think COVID, I'll just say, you know, we're on Epic. That's our electronic medical record, and we have MyChart for those of you who are familiar with that. So that's a communication vehicle. But pre-COVID, not a lot of people were real interested in being engaged electronically. It was just kind of out of their mindset. But the loop being presented by their physician, patients buy into that. It's important for me and my care about this specific procedure. Great response rate. Nearly 80% of our patients who are invited participate in the loop. avoiding unnecessary office visits. 86% of our patients. And for all of these patients, they're on a pro fee schedule. So if they have to come back into clinic, we're not getting paid anything extra for that. So if we're able to free up clinic spots for other new patients, that's a win for us financially, because we're optimizing our teams in clinic, not having to do follow-up care that we've been able to avoid because of interfacing with people in the loops. Patient satisfaction is excellent, and this is really clever. When the patient at the end of their loop, they're asked about their satisfaction with their surgeon. If they rate it really high, they're given an opportunity to go directly to external rating mechanisms like health grades and rate their doctor. And so that has drastically increased the volume of patient feedback we have out on the internet, and it's amplifying our happiest patients. Unhappy patients are happy to talk about you, not always the happy ones. So this is a great vehicle for driving your most successful, happiest patients out externally to give feedback to other prospective patients. And we also use GetWell Loop as a vehicle to deliver patient-reported outcomes. So depending on if you're in that realm of delivering surveys, those kinds of things, GetWell can be a vehicle by which those things are actually delivered to our patients.
Perfect. And we do have a few patient quotes here that we pulled from the system. And I know it's something that our team is keeping track of, but kind of tagging on to what you had said, Jamie, just around that overall patient satisfaction, asking patients periodically through their loop experience, what have they thought? What could have improved? What did they really enjoy? And we just pulled a few pieces of feedback from some of your patients that have circulated through the loop experience. So we won't read all of these, but Jamie, I don't know if you have anything to say about this, just around overall patient experience, what you've heard from some of your patients.
Yes, we continuously get great feedback from our patients, both about us, but also about the loop, as you can see in these comments that are specifically mentioning how valuable the loop was to our patients. What this says to me is it really empowers our patients to move from a place of healthcare happening to them to being an engaged, active participant in their healthcare. It really makes them feel that way. Oftentimes I think patients think that healthcare providers, particularly their surgeon, they're too busy for my little problem. Oh, maybe my fever's a little high, or my wound might look a little iffy, but I'll just wait. I don't want to bother them. And then it turns into a full-blown infection. But when you create a vehicle by which it's so easy to communicate with us, and we encourage that communication, they're talking to us, they're letting us know things, and we're able to engage with them and prevent wildfires from happening. So it's been a really great opportunity for patients to have a better experience with us, and us to have a better experience with our patients too.
Yeah, well, and I think really empowering them to play a part in their overall care, right? Which sometimes you don't see from patients. And I think this becomes a great vehicle for that. So thank you, Jamie. I do also will just want to take a moment. So along with some of our core loop metrics that you went through, I also want to do a little brag on your behalf and just take a deep dive into your participation in the total joint replacement bundle program when we first got started. So as a key part of the participation, I know you all were looking at a number of things. So thinking about reduced cost to Medicare, which can really encompass reduction in post-acute care to a skilled nursing facility, reducing readmissions. And then with that, how do you maintain or improve overall quality, which Jamie, I know is very close to what you're working on. So when we're thinking about quality, things like patient satisfaction, reduction in complications, and then that collection of those patient-reported outcomes. So in order to achieve some of these things, you all needed what we've talked about consistently throughout this conversation, just that standardization of those care pathways, full engagement from your patients during that entire episode, an early warning system if patients do experience complications throughout that overall episode of care, and then something that you could all facilitate the collection of patient-reported outcomes while improving that patient satisfaction across the board. So in order to do that, so proud to say that you all chose Loop to help facilitate And the ultimate results were phenomenal. So looking at overall patient satisfaction, and Jamie, you did touch on this in the last slide, but there was an improvement from 4.2 to 4.8 health grades reviews that were increased over time. So what this ultimately helped to do is just elevate that external public profile and hopefully then likely initiate referrals back into the organization. So we do ask patients, how likely would you be to recommend your friend or family member? And post-loop or pre-loop go live to post, we were able to track those improvements over time. And then switching over to the middle of the screen, so that post-acute care within the skilled nursing facility went from 15% all the way down to 5%, with an overall decrease in readmissions from 3% to 2.1%, which is phenomenal. And then to round everything out, Froedtert saw an overall cost savings of just under $500,000 in year 1 and up to $1 million in year 2. So again, just highlighting the phenomenal work from your team. Great job. I think we can all agree that it was a very successful start to getting Loop into place at Froedtert, and really just overall seeing that success in orthopedics. So with that as our starting point, Natalie, I do want to turn it over to you. I think it's become clear to those listening what that overwhelming success in orthopedics looked like. But can you talk us through just that fuller breadth of the program and where you all chose to expand Loop to next across the Froedtert system?
Yeah, absolutely. And the intention when we went live with Loop was to scale across the system. You know, we're not doing onesie twosies. I think in a couple of cases you'll see on this slide that we have a few listed that have some custom loops that we have completed for these areas, but it is always an implementation in mind to scale to the rest of the broad organization as a whole. So you can see back in 2016, we started with ortho and musculoskeletal services, rolled over into spine, expanded over to GI, heart and vascular, ambulatory, COVID. Obviously, we threw in a couple COVID loops on a whim. I'm sure some of your other customers did as well. And then we have some other specialty areas and again, additional kind of more population health-based loops. So I won't go through these in particular, but we have over 40 care plans kind of organization-wide that are live and running and enrolling our patients for care. So this is really exciting to us. I think the other really cool thing is that we, as Inception, I myself am not going out seeking people to get involved. This has all been a chain reaction, like domino effect from ortho at the beginning of 2016. So thank you, Jamie, to you and your team. This has just been so easy. I mean, we have people seeking us out to say, what can we do? Is there a loop for this? Is there a care plan for that? You know, in a lot of cases, I think we just actually are developing a couple additional custom loops for surgical oncology procedures that don't currently exist. So part of our partnership with GetWell is helping to develop and expand that care plan and the use case. I think, Megan, you'll be pretty candid with the fact that we kind of push you guys outside the box and you take it well. So, but we love that. And it's just, the program is so good for so many reasons that to be able to expand this across our system, and you can see particularly with inpatient discharge and different things like that. Like we love to think of different ways to leverage Loop for our patient care.
Yeah, no, that's amazing. And I think what's highlighted here, the 40 plus that are being utilized across the system today, across our Loop library, we have over 250 spanning 20 different service lines. So it does go pretty deep, I think, allowing for organizations to implement this in a way that feels best to them. But to your point, like, we learn from you all. So you are constantly pushing us. I think it makes us better every day. I can always go back to this. Like, you learn so much about the clinicians and the patients that work through the system. And it only makes us better to just take on that feedback and, you know, optimize very, very frequently. So Natalie, thank you just for taking us through like how that was then expanded across the system. I think we'd be very interested in walking through just what some of those initial results have been as we're thinking about those other areas outside of orthopedics. If you wouldn't mind just talking us through the outcomes that you've seen beyond what we've done in orthopedics.
Yeah, absolutely. And these are really exciting on this slide. I'm excited to talk about them. We recently, I believe, I don't even think it's out in JAMA yet, but by the time the webinar comes out, it may be, so watch for it. Our Medical College of Wisconsin research group did do some investigation and analysis on our COVID active symptom exposure monitoring loop. And of those patients that we offered GetWell to, and those were monitored actually by our virtual care team. So we had 24/7 nursing care monitoring our COVID loops, which I think was really imperative as well. But 33% were less likely to be admitted because they were also engaging in loop. And again, it may be, I mean, that's incredible, first of all, but it also may be very well attributed, and I would love to give props to our virtual care team and our leadership on the Inception side for that component particularly, because early on in those COVID loops, we realized that COVID didn't care if it was business hours. Right. We had patients triggering red alerts at 10 p.m. And as a nurse myself, I was like, I can't sit here, you know, and this was at the very beginning. I was like, I can't sit here and let this patient have difficulty breathing. So we'd be calling. So we moved into that 24/7 care model, and that has made all the world of difference. So that's incredible. That article should be out very soon. So excited for the team that's off the ground. In the middle of the slide, you can also see we have, I kind of briefly mentioned our inpatient discharge loops that we have. So we have stratified it by low risk and high risk patients. And all of our patients previously were getting a phone call from our transitions of care nurses, and it was just taking too much time. We realized that the low risk patients typically didn't need much from us. And so what we did was we put in a kind of a loop only approach to our low risk patient population. And by doing that, we saved 1.5 FTEs of RN efficiency. So no longer giving out that phone call, but putting them on loop to make sure that they were managed and engaged. And if they did need something, then we, again, would reach out with more care by exception, as Jamie mentioned earlier. That also has led to significant growth in our TCM revenue. So really a win-win on all fronts regarding that implementation. And then you can see on the far right, we've serviced over hundreds of thousands of patients, which is so cool to see this continue to grow. We just, again, I can't say enough about Loop and the fact that we have such a good, close collaborative relationship with you guys and are able to service and service them well. I mean, these patients are happy and they're having good outcomes, and the organization is benefiting in so many ways. And most importantly, our patients are having a great experience. So this is just, I'm done being excited now.
No, I love it. Thank you so much, Natalie. That's great. I love seeing everything, I mean, just from where we started into what this has become, and that we've all been able to be a part of that entire journey. It's great. As we're coming to the end of this, Jamie, I'll come back to you real quick. Any closing thoughts on your end before we wrap things up?
Sure. What I would offer for our audience is that if you're looking to add a technology layer to how you interface with your patients and communicate with them, this is a great opportunity to consider. It's worked so well for us. I frankly cannot imagine running our program without the additional layer of GetWell Loop. It creates operational efficiency. You really can customize how you implement the loop based on your existing care model. So it really makes it easy, regardless of how your program is built, to be able to figure out the best way for you to operationalize that. we've found that it works great in our navigation model, because that really is based on a continuum of care that starts preoperatively and continues postoperatively. And this loop does that. It starts 3 weeks before surgery, goes till 3 weeks after surgery. And it allows us to do something that I would call being proactively reactive. In healthcare, we oftentimes have to respond to what's going on, but being able to respond as quickly and as nimbly as possible is really how you provide the best care and keep your patients out of trouble. And when we're talking about postoperative space, it's all about that. It's optimizing their recovery, keeping them out of getting into trouble, and creating the best experience they can have.
I love it. Proactively reactive. I think we'll use that more often. Well, Jamie, Natalie, thank you so much for everything today. We always learn so much talking with your team, and I just really appreciate you taking everyone through your overall experience today. For those of you thank you for joining us today. That concludes our webinar. For any of you that do have any follow-up questions, would like to learn a bit more about what was presented today, GetWell Loop, please feel free to contact me directly. My email is mmancini@getwellnetwork.com. So thank you everyone for joining. Have a great rest of your day.
Thank you, Megan.
Thanks for having us, Megan.
Yeah.